Hey everyone, thanks for joining us in our series of free webinars. We're hosting these every day, every weekday at 10 a.m. We'll go through May 1st and then hopefully continue after that. A series of really interesting topics hosted by our physical therapists, some very topical information, things that you can use right now, including the topic today, sleep hygiene. Presented by Richard Evans. Richard is the clinical director of our Southwest Fort Worth GTC location. He graduated with his doctorate of physical therapy from the University of North Texas Health Science Center in 2017 and has worked for GTC since graduation. Richard is currently working towards becoming board certified as a specialist in orthopedic physical therapy. He is certified in dry needling for musculoskeletal disorders and completed advanced training in managing people with chronic low back pain as well as vestibular disorders. In his spare time, Richard likes to exercise, hike with his wife and two golden retrievers, and he has recently started taking up golf. So I'm going to turn this over to Richard and we'll let him go through his presentation. I'll be back at the end to wrap it up. Here you go, Richard.
All right, thanks, Brad. I want to thank everyone for tuning into this webinar today. The topic of today's webinar is sleep hygiene and managing stressors during this COVID-19 pandemic. Working as a physical therapist for the last 3 years, one of the biggest challenges I've seen facing my patients is the lack of good quality sleep they're actually getting. So hopefully with this presentation, we can accomplish a few of these objectives I'm going to talk about now and help you hopefully get better sleep and be better able to manage some of these stressors facing everybody. So the first objective of this presentation today is help people recognize the difference between modifiable and non-modifiable stressors. Discuss common ways that people manage stress. Discuss the role that sleep plays in managing stress. And identify strategies to help improve your sleep hygiene. So what are the different types of stress? So we have non-modifiable stressors, and these are things that unfortunately are out of our control to change. So one good example of that right now would be the spread of this coronavirus pandemic. We can do our best to try to stay at home and limit the spread of this, but unfortunately it is out of our individual power to stop this thing from spreading, and that can be very stressful, and sometimes just recognizing that that is out of your control can take some of that stress off of your own shoulders. Losing your job due to this pandemic. Unfortunately, it doesn't matter how well you're doing at your job right now. If your company has had to close because of some of these shelter in place orders, you've probably lost your job, and that can be really stressful. Sometimes just stepping back and recognizing that it has nothing to do with your performance at work can help take some of that stress off of you. If you've got children staying at home right now, that can definitely be a stressor, and unless you're planning on kicking your children out of the house, which I don't think you should do, that's going to be a stressor that unfortunately is outside of your control right now. But we also have modifiable stressors. So an example of that would be exercise or the lack thereof. It is important that you get some exercise, but it's also important in times like this that you don't decide to pick up training for a marathon or something that your body's just not really conditioned to do, because that can place excess physical stress on your system. The types of food you eat. So this is a perfect time to take a look at your diet and make sure that you're not just eating quarantine snacks, but you're actually having a balanced diet right now. And then the amount of sleep you get. So if you are not sleeping really well, that can definitely increase the amount of stress that you feel and limit your ability to deal with these stresses you're facing right now. So what are some common ways people manage stress? So as a physical therapist, I'm a little biased, but I do believe that getting regular exercise can definitely help you manage stress. So these are my two dogs here. I like to take them on walks every day. So something as simple as walk around your neighborhood can definitely count as exercise. You don't have to go to a gym. It doesn't have to look like traditional exercise to actually be exercise, just something that gets you up and gets you moving. Like we talked about earlier, eating a balanced diet. So my dogs start their day with 2 cups of kibble. I don't recommend you start your day with 2 cups of kibble, but try to have a balanced diet that has some sort of protein in it. Make sure you're getting your fruits and veggies can definitely help you feel better and in turn manage stress more appropriately. Try to have some quiet time or meditate. So when my dogs get too stressed, I let them out in the backyard and they like to stare at squirrels and just be out in nature. Uh, Lots of studies have shown that just having some time each day that you set aside to sit in a quiet room can definitely help you maintain and manage your stress levels. And making sure that you get adequate sleep. So if there's one thing my dogs do really well, it is sleep. And that's kind of the whole point of this presentation today, is go through some different strategies to help you hopefully get better sleep. So why all the fuss about sleep? So the CDC took a look at a study in 2014 that found that 1 in 3 adults don't get the recommended amount of sleep each night. And that happens to be about 7 hours. Lack of sleep can actually have a lot of detrimental effects on your body. So lack of sleep can cause poor attention, poor concentration, poor memory. It can lead to increased irritability and other mood disturbances. It can actually cause your immune system to be compromised and not function as well as it would normally. It can actually alter your endocrine function, and it puts you at an increased risk of developing chronic or persistent pain conditions. So let's talk a little bit about sleep and the immune system. So while you're sleeping, your body actually produces cytokines, which are these little chemical messengers that helps your immune system identify and contain infections. And these cytokines are produced while you sleep. Lack of sleep can actually lead to a decreased production of cytokines. As a result, this can make you more susceptible to getting sick when you encounter bacteria or different viruses. And obviously, with what's going around right now, you definitely want to make sure your immune system is functioning as close to 100% as possible. Let's sleep because, we love our immune system. We want to make sure that it is working to help defend us at times like this. So sleep and endocrine function, like I talked about earlier, if you're not sleeping well, you can actually have altered endocrine function, which can place you at an increased risk of developing different conditions such as diabetes, high blood pressure, obesity, and you're actually at an increased risk of having a stroke with lack of sleep. These are important because all of these different comorbid conditions actually increase your mortality rate if you do contract the coronavirus. So, not only can sleep help you, possibly fight off the infection faster, but it can help decrease how dangerous the disease is, or that the virus is, if you actually do get it, by hopefully keeping your risk of developing some of these other comorbid conditions really, really low. And then let's just talk a little bit about sleep and pain. This is what I deal with most of the time. So people come to me and they've been in pain for a long time, and we're trying to figure out why they're in pain. And oftentimes we find a pretty strong link between their sleeping habits and their pain levels. And sometimes it's a little bit of the chicken and the egg situation. Are these people not sleeping well because they hurt, or do they hurt because they're not sleeping well? People much smarter than me have done studies regarding this topic. And an example I'm going to give you here is fibromyalgia, which is a chronic condition that has been well studied, but we can't seem to figure out why people develop this. One thing that they have found, though, is there is a significant relationship between poor sleep habits and the development or the onset of fibromyalgia. So that is a possible link as to why people come down with this condition. And again, you could argue that maybe people can't sleep because they're in pain, but I'm going to argue that people are maybe a little more sensitive. Things hurt more when they don't sleep and they're not well rested. So what does a good sleeper look like? What do we want you to look like by the time we're done with this presentation and you implement some of these tips I'm going to give you? So this is my dog Marley. He's definitely a good sleeper. He can sleep in any position at any time. But for humans, a good sleeper usually takes less than 30 minutes to fall asleep. They'll usually wake up on average 1 to 2 times during the night. And it's important to note that even the best sleepers will have off nights. So I don't want you to put too much pressure on yourself thinking you've got to have a good night of sleep every single night, because that's just not realistic. Um, there are going to be nights where you wake up maybe 3 or 4 or 5 times, or it takes more than 30 minutes to fall asleep, and that's okay, as long as you're continuing to work on your sleep habits and your sleep patterns. That's what's going to pay off in the long run. Next question I get a lot from patients is, how much sleep do I actually need? So I put this chart up here. I got this from the CDC website. And you actually need minimum 7 hours of sleep a night. I have many people come in and tell me that, they get by on 4 to 5 hours. There are a certain subset of the population that, they're termed super sleepers. They can actually get by on less than 6 hours of sleep, but it's a really low percentage. So for most of us out there, we need 7 hours. You might be functioning on 4 to 5 to 6 hours of sleep, but you're not functioning at 100%. Also, if you take a look at that list, your teenage children or your younger children actually need more than 7 hours of sleep. So if your teenager's sleeping to noon each day, it's probably because they need the sleep. So let them sleep. And so the rest of this presentation, I'm going to talk to you about how sleep hygiene or sleep habits can help improve your sleep game. So like I said, sleep hygiene, just another way of saying sleep habits. I got most of this information from the Center for Clinical Interventions, and I link the website there. You can go ahead and take a look at that. They've got a lot of really good information there. They also have different handouts. One handout is a sleep diary worksheet, and we'll talk about that here in a bit. So the first tip is to get regular. Try to go to bed and wake up at the same time each day, during the week and on the weekends. This is something I really struggle with. During the week, I normally get up at around 5:30 and I go to bed. I try to go to bed at 10. On the weekends, that changes. You're going out with friends and you don't get to bed till midnight, and then you sleep in till 9 or 10 the next day. And that can really throw off your routine. Brains like routine, and staying in some sort of rhythm can help you establish a better routine. Right now everything's closed, so it should be pretty easy to get into a routine. So take this time where we're forced to stay home to develop, better sleep habits and go to bed at the same time and wake up at the same time. So your next door neighbor who gets up and cuts his yard at 7 a.m. on the weekends, he's just practicing good sleep hygiene. So don't be too mad at him. The second tip is don't force it. If you're not able to fall asleep after 20 to 30 minutes of lying in bed, get up and go do something else. So go sit in a quiet room, read something really boring. Just try to avoid something that's stimulating. So don't get on your phone and scroll through Instagram. Don't go watch a really exciting TV show, because then you're just going to wake yourself up. It'll be even harder to fall asleep after that. Like Regina George said, stop trying to make sleep happen. It's never going to happen. I'm not sure if that's exactly what she said, but for the purposes of this presentation, I think that's what she did say. The next tip is try to avoid caffeine, nicotine, and alcohol. So, I don't want to be the fun police, but if you want to have better quality sleep, it's really important to try to stay away from some of these substances. So, a lot of my patients tell me that, a glass of wine or a glass of bourbon right before bed can actually help them fall asleep, and that might be true, but it can actually decrease your sleep quality. So you might fall asleep really quickly, but it actually keeps your body from falling into those deeper stages of sleep where all the really good stuff happens, where your body starts to heal itself. So we want to make sure that you're avoiding alcohol right before bed, and then try to avoid consuming nicotine and caffeine 4 to 6 hours before bed. Obviously, people have different tolerance levels. I know some people who can drink a cup of coffee 30 minutes before bed. and they can fall asleep no problem. But for most people, that's not going to be the case. So try to stay away from coffee, tea, soda, chocolate, anything that has caffeine in it at least 4 hours before bed. My next tip here is try to make your bed for sleeping only. So this goes back kind of to that first tip I gave you about routines. If you're constantly watching TV, studying, eating, Netflix, binging in bed, your body will start to associate, and your brain will start to associate your bed with those other activities. And we really only want it to associate your bed with sleep. So if you need to binge Netflix, try to do it in the living room or sit up in a chair. Try not to do it in bed. This is a hard one for me. No naps. I really enjoy an afternoon nap, but napping can actually make it harder for you to fall asleep later in the evening. So try to avoid napping. If you're one of those people who can't make it throughout a full day without a nap, try to keep it to less than an hour and before 3 p.m. Now, obviously, that's going to change if you normally sleep a little later. But if you're looking at getting to bed around 9 or 10, try not to take a nap any later than 3. And I think we've all been here before where you say you're going to take an hour nap and you wake up 9 hours later looking like this guy. So if you are going to take a nap, set a timer on your phone and force yourself to get up so that you don't ruin the routine you've gotten yourself into and make it harder for you to fall asleep later that night. This tip is actually pretty interesting. I'm going to talk about bath time. So there's some pretty cool research to show that your body cooling off can actually help make you sleepy. So if you take a hot bath 1 to 2 hours before bedtime, as your body temperature falls, you should start to get sleepy. So this is for people who have trouble falling asleep. You might try to take a hot bath a couple hours before bed and see if as your body cools off, you get sleepy. And then it works with some people, it doesn't work with others, but it's definitely something that's pretty easy to try and to implement. Talked about this a little earlier in the presentation, and you can go to that website I linked earlier to download a copy of a sleep diary. But essentially, a sleep diary is just some form that you track when you fell asleep, how long you fell asleep, how many times you woke up. This can help identify maybe some other issues you're having, and if you are noticing a pattern, you can start working on that yourself, or you can go talk to your doctor about it and say, hey, I've noticed, I can't fall asleep or I can't stay asleep, and that can help better inform what they want to do next with you. So it's a useful tip. I try to keep a sleep diary, and it's really pretty cool to look back and see how much sleep you're actually getting, because that's another thing as well. So people will say, yeah, I get enough sleep, but if they were to actually sit there and track it, they oftentimes start to realize how little sleep they're actually getting. This one's right up my alley here as a physical therapist. So again, I told you I'm a little biased, but regular exercise can definitely help you develop better sleep habits. There is one caveat to this. So you want to try to avoid strenuous exercise 4 hours prior to bedtime. Reason being is that sometimes exercise can be pretty stimulating. So you don't want to work out an hour before bed because it can be hard for some people to fall asleep after that. As far as your diet, I'm not a nutritionist, but I can give you some basic nutritional advice. Try to keep your diet balanced. I know there are a lot of fad diets out there right now, and I'm not going to comment on that, but if you're trying to develop proper sleep habits, now is probably not the best time to start some of those crazier restrictive diets, because that can actually throw off your sleep habits. So some people say they can't sleep on an empty stomach, so having something light right before bed might help them fall asleep. But very, very heavy meals can actually interrupt your sleep and decrease the quality of your sleep. Again, I think we've all been here before. If you've worked out right before bed, you just lay in bed looking like this lady here. So try not to work out right before bed. And then this is a pretty cool tip here. Make your bedroom a sleep sanctuary. I think the entire house is a sleep sanctuary for my dogs. They can fall asleep anywhere. What I mean by sleep sanctuary is try to have your bedroom as quiet as possible. if that's something that you can't do, you can invest in some earplugs, or you could even try to get thicker curtains that cut down on the street noise if you live on a busy street. Try to make your bedroom as dark as possible so you can get blackout curtains or order an eye mask. And then try to keep your bedroom a little colder. So research shows that we sleep best in colder environments, anywhere between 60 to 67 degrees. Um, this is a perfect time of year here in Texas to start practicing this. You can crack a window at night and it should feel pretty good. I know during the summertime it might get a little harder to do that with how hot it gets. Um, but if you can afford it, try to turn the AC down, or even just get a fan to get some air moving, because most people sleep better when they're a little colder. And then the last thing I want to talk to you guys about was something we're offering here at Greater Therapy Centers now, telehealth. So if you have any specific questions related to any musculoskeletal conditions, so back pain, knee pain, shoulder pain, neck pain, or if you feel like you're not really sleeping really well and you feel like it might be related to something we talked about in this presentation, you can reach out to me via email, and I put it up on the screen there. It's revans@gtc-pt.com, or you can call our office here at 817-294-4646 and just tell the person on the phone that you're interested in setting up a telehealth evaluation. They can give you more information on rates and how all that works. This is something we're trying to offer to people in this crazy time, because it's safer than going out to your doctor's office. It's complying with all the shelter-in-place orders, and a lot of people have time on their hands. So if you've got that nagging knee injury, that nagging back injury you want to get looked at, feel free to reach out to us. If it's something that's just a simple question, don't hesitate to email me. I don't mind responding to email. Or if you have any questions about this presentation, reach out to me and we will, I'll try to answer those questions as best as I can. So thank you for listening to this webinar today. Like I said, if you have any questions, reach out to me. If not, have a good day. Thanks.
Thanks, Richard. Great information, great presentation, definitely topical and useful for what's going on with everybody today and going into the future. Like Richard said, we do have the telehealth option available. You can check out our website, our Facebook page, and then also all of these webinars that we're hosting every weekday will be posted on our YouTube channel as soon as they're processed. So no later than the next business day after the scheduling of these webinars. So be sure and check there. Thanks a lot for joining us and have a good day.